Hi, I'm Martin Trope, and I've decided to do just a very short video just stressing the subtle differences between these new adaptive instruments that you may have been introduced to in a lecture, in a hands-on course, or even a rep introducing them to you and dropping off some samples. And these, there are 3 or 4 very important differences in using these instruments compared to the typical night eye file. And we found that a lot of people, because they've been using the round night eye files for so long, just tend to forget them. So I'm here to reinforce them and to stress them for you. Okay, so the first absolutely essential point that has to be stressed is the speed that these instruments have to be used at. Most nickel titanium rotary files are used 300, 400 RPM. And these files need to be used at a much higher RPM. The shaper is an 01 taper, so the core is very thin, and that gives you a lot of leeway in terms of cyclic fatigue. These instruments are very resistant to cyclic fatigue because the core is so narrow. The finisher is even better because it has no taper at all with a 25 size. The difference here is that if there is tip lock, in other words, the tip gets locked within the canal, the file will break from torsional fatigue. So we have to make absolutely sure that the tip will not lock in the canal. And this is done by going at a higher speed. So you've got leeway to go to higher speed in terms of cyclic fatigue, and the increased speed decreases or eliminates the chance that the tip will lock, making the instruments extremely safe to use. However, if you use them at 300 or 400 as you're used to, then the chances of the tip locking are much greater. These instruments are recommended to be used at 800 to 1000 RPM. My preference is 1000. I think the higher the speed, the safer the instrument. These should be used in rotary motion. And you know, again, I want to stress that if you're using a rheostat, you have to train yourself to put your foot completely and heavily on the rheostat, so the file is going at the speed that you set it at. The second very important difference is how we use the file and the motion of the file. In most nickel titanium rotary round files, we are taught to pack and advance the file with a little bit of pressure. Here, remember, we're going at 800 to 1000 RPM, so the file should be moving on its own into the canal. If you know the file, it has a passive tip, but just behind the passive tip there is what is equivalent to a carbide burr, a 6 rounded carbide burr. So this is creating a lot of debris, and we must not peck and force that debris ahead of the file. Behind the tip is a very narrow core material, and that narrow core material allows the debris to escape into the main canal. So it's very important that we engage and then completely disengage to allow the debris to float and move into the main canal, so that we don't get any debris ahead of the tip of the instrument. And that I'm going to demonstrate right now. So here is a plastic block that I'm going to demonstrate the motion of using the shaper. So here I'm adding hot water because we want to increase the temperature to above body temperature. And you see that the 31 gauge needle goes about halfway down the canal. So now we take the shaper and place it into the canal until it engages, and then remove it. So we start the file disengaged. Start the file and it's engage 2, 3, disengage completely. Engage 2, 3, disengage completely. Engage 2, 3, disengage completely. And you should go down about 2 to 3 millimeters every time you do that. And since a canal is usually between 10 and 12 millimeters, within 3 to 5 engagement, disengagement, you should be at your working length. If at 5 tries or 5 engagement, disengagement, you're not at your working length, you need to stop, irrigate, and recreate your glide path. So here I've got to my working length, and now I'm going to irrigate again. And you'll notice that because the file is a 30 diameter, 0.3 diameter, and my 31 gauge needle is less than 0.31, after those 3 to 4 engagement, disengagement, I'm already irrigating the entire canal and effectively removing the planktonic bacteria. Now, if I choose to increase the taper to 0.4, I need to go 10 more engagement, disengage strokes. So I'll just demonstrate 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And what I want to demonstrate here is, because of the disengagement, you see that the vast majority of the debris is in the coronal segment of the tube here, and the apical part is free of debris. If I would have pecked, as you do with a typical rotary round file, all the debris would be forced into this apical part. Now with my 31 gauge needle, I can very easily remove all the debris from the canal. The next thing I want to just talk about is the finisher. Now the finisher comes in this sleeve that I can show you under the microscope afterwards, and this finisher is the instrument that does the rest of the job in terms of scraping the biofilm and dirt, etc., from the root canal wall. And I just want to show again a few subtleties when using the finisher of how to get the most out of it. All right, so the finisher will expand and contract as you move it up and down a canal. So you see when the bulb is contracted, the tip expands. When the tip is contracted, the bulb expands. And that's a very nice feature, obviously, and that's going to allow it to get into areas that no other instrument can get into. What I want to talk about is how you use this instrument above the orifice. So here is a split canal, and you see it goes down one of the splits and then the other of the split. But it's important that you understand why it's going down one and then the other is what I do up top. I'm moving the file up top to subtly change the orientation of the tip. So it's very, very important when you're using this instrument clinically, where you can't see what you're doing below the orifice, that when you get the instrument into the canal, that you move it not only up and down, but you move the top, you know, sort of north, south, west, east, while you're going up and down to get the maximum potential for the instrument to get into all of these canals. Now, another thing I want to just demonstrate by means of a video is how to get the finisher into the canal. This is something that does take a little bit of a learning curve, and I hope that this video will help a little bit. All right, so here is an upper molar after the shaper has been used in all 4 canals, and now we're going to use the finisher. So the first rule is start with the biggest canal, because that's the easiest to get into. And as you see here, the palatal was very easy to get into. It's large, and you know, you just use this for your 60 seconds total, and then you're ready for the next canal. So then what I do is I just place it in a canal. In this case it's a distobuccal canal, just below the orifice, and then very, very slowly thread it into that canal. And then see where it lines up. If it doesn't line up correctly, you just change the orientation, and here it goes into the mesiobuccal 2. And again, very, very slowly thread it into the canal, and this will then make it easier to get into the mesiobuccal 1. You see it's not oriented correctly, so we just spin it until it does orient correctly, and then just slightly below the orifice, and then thread it slowly into the canal. And it does take a little bit of learning, but you know, this becomes easy after a while. So just basically to summarize, we need to place the finisher with the curvature towards the cusp, place it just slightly below the orifice if possible, and then turn on the motor, and then very, very slowly. I cannot stress enough how important it is to advance the finisher slowly into the canal. You're threading it into the canal, and then it will find its own way down the canal. Now, something that has been talked about is also it is possible to straighten the finisher with alcohol gauze or ice, water, etc., and that straightens it, and sometimes that will help to orient it with the orifices and get it just below the orifice. Generally speaking, it takes a little bit of practice, but once you use the rules of orienting the curvature towards the cusp and lining it up just below the orifice, it's very, very easy to get the finisher into the canal. Well, I hope these very important tips are useful, and this is in no way instead of a lecture. This is no way instead of a hands-on instruction. If you'd like to look at our website, Next Level Endodontics, we have many courses available, including courses where I give live demonstrations on patients. But certainly these are critical points that must be taken care of if you want to use these instruments in the most effective way. Thank you.